Hello and welcome. I am just so very glad you've decided to sit down, maybe grab a warm cup of tea, and spend some time with me today. You know, if you're watching this right now, there's a really good chance that you, or perhaps someone you love deeply, has a very specific morning routine. It usually involves a small, seemingly completely ordinary pill. You wake up, you pour yourself a fresh glass of water, you pop open that familiar little orange prescription bottle, or maybe you use one of those plastic daily pill organizers, and you swallow a medication for your blood pressure. It's such a quiet, routine moment, isn't it? It's so familiar that it's incredibly easy to just take it entirely for granted. But today, we're going to slow things down a bit. We are going to look really closely at that daily routine. We're going to explore 3 of the absolute most common blood pressure medications prescribed today: Amlodipine, Lisinopril, and Losartan. My goal for our explainer today is to offer you a really calm, clear, and easy to understand breakdown of what these medications are actually doing the moment you swallow them. Because honestly, truly understanding your health, that is the very first step toward protecting it. I really want you to ask yourself that question honestly for a second. Do you actually know what that morning pill is doing inside your body right at this very moment? And I don't just mean what the little printed label on the bottle says. I don't mean that one brief sentence the pharmacist might have quickly mumbled as they handed you the bag over the counter. I mean, do you truly, fundamentally understand how it works? Millions of us, millions of careful, intelligent, educated folks take these medications every single day on pure autopilot. But here is a truth we really need to remember, and it's a big one. These are not vitamins. Amlodipine, Lisinopril, and Losartan are incredibly powerful medications. Every single day, they are literally changing the way your heart pumps, the way your blood vessels stretch, and the way your kidneys function. And yet so many of us take them with kind of very little understanding of what signs to watch out for, what common everyday things we should maybe avoid, or how to tell the difference between a minor everyday annoyance and a serious signal that your body is desperately trying to send you. Well, today we are going to change that together. By the end of our conversation, you're going to have the clarity, the peace of mind, and the confidence you truly deserve. Okay, so here is our roadmap for today's explainer. First, we'll cover more than just a label. Second, we'll look at amlodipine and the swelling effect. Third, lisinopril and the relentless cough. Fourth, losartan and the potassium trap. And finally, we'll wrap up with the essential rules for every blood pressure pill. Section 1, more than just a label. Understanding the categories. It is just so incredibly important to understand right out of the gate that not all blood pressure medications are the same. They might all have the exact same end goal, lowering those scary numbers on your home blood pressure monitor, but they take completely different pathways inside your body to actually get there. Knowing your pill's specific category is the absolute key to your safety and your day-to-day comfort. To explain why this matters so much, I want to share a true story with you about a gentleman named Walter. Walter is honestly a lot like many of the wonderful folks I talk to every single day. He was 74 years old, a former engineer, very sharp, and just a very methodical guy in how he lived his life. He took his medications exactly as his doctor prescribed, literally never missing a day. In fact, his daughter had kindly set up one of those Monday through Sunday daily pill organizers for him, and Walter managed it perfectly. When his doctor added a new pill called amlodipine to his routine to help get his numbers down, Walter just figured, hey, it's just one more blood pressure pill. Same basic thing, just a different name, right? He thought it was no big deal at all. But that simple assumption almost cost him a wonderful, productive year of his life. About 3 months after he started taking it, Walter's feet began to change. And I mean, they changed so much that he couldn't even squeeze his feet into his regular, comfortable walking shoes. By 4 o'clock in the afternoon, his legs felt incredibly heavy, just tired and uncomfortably full. His skin felt tight and shiny, almost like a water balloon that was ready to burst. He was absolutely terrified. He started walking less and less because moving just felt so difficult and strange. He quietly told his son that he truly believed his circulation was completely failing, and he even started searching the internet for signs of heart failure. He was living in absolute fear, all because he simply didn't understand the physical mechanics of his new medication. Section 2, amlodipine and the swelling effect. So Walter was living with this terrible, terrible anxiety, but the reality of his situation was actually quite simple and entirely manageable. The problem was nobody had ever taken the time to sit down and just explain it to him. Let's make sure that doesn't happen to you. Amlodipine belongs to a category of medications called calcium channel blockers. Now, I know that sounds like a super complicated, highly technical medical term, but I want you to simply picture the plumbing in your house for a second. If the pipes in your home are really rigid, tight, and narrow, the water pressure inside them is going to be sky high, right? Well, your blood vessels work the exact same way. If they are tight and restricted, your blood pressure goes up. Amlodipine works beautifully, much like a master plumber, It steps in and literally relaxes the smooth muscle walls inside your blood vessels, specifically targeting your arteries. By relaxing and widening those vessel walls, your blood can suddenly flow much, much more easily, with far less resistance pushing back against it. And just like that, your blood pressure comes down to a nice, healthy level. It is a wonderful, highly effective mechanism. But it comes with a physical side effect that catches so many careful people entirely off guard. Here is what is actually happening in your body, explained as simply as possible. When amlodipine relaxes the small arteries in your legs, blood flows down into your lower extremities much more freely. It's like opening up a wide highway. But your veins, those are the specific vessels responsible for working against gravity and pumping that blood back up to your heart, they do not relax in the exact same way. They stay a bit narrower. So what happens? You end up with a microscopic, completely invisible traffic jam. You basically have more blood coming down into the foot than going back out. And because of this imbalance, pressure starts to slowly build up in those tiny, delicate vessels near your ankles and the tops of your feet. Eventually, that gentle but constant pressure pushes a little bit of fluid out of the vessels and right into the surrounding tissue. The result? Puffy ankles. Socks that leave deep red indents on your skin at the end of the day, shoes that feel way, way too tight by the evening, legs that just feel heavy and exhausted. I want to reassure you right now, with absolute certainty, for the vast majority of people, this is not a sign that your kidneys are failing. It is not the beginning of heart failure. It is simply a predictable physical traffic jam caused entirely by the way amlodipine works. Now, the swelling itself isn't usually the most dangerous part of this whole situation. The danger actually comes from how we naturally react to it. Some folks look down, see their swollen ankles, get deeply scared, and abruptly stop taking their pill without telling a soul. Please, whatever you do, do not do that. That is incredibly dangerous because your blood pressure can silently spike right back up to stroke level numbers without you even feeling it. Other people think to themselves, oh no, I must be retaining fluid, so they consciously stop drinking water. Please, don't do that either. Dehydration carries severe risks of its own, especially for older adults. And some folks, just like our friend Walter, simply endure it in silence. They stop taking their daily walks, they lose their mobility, and they lose their precious quality of life out of sheer fear. The right move, the absolute best thing you can possibly do, is to just talk to your doctor. Let them know exactly what is happening. There are so many easy, safe strategies here. Sometimes it's as simple as elevating your legs for a bit in the afternoon, or changing the time of day you take the pill, or having your doctor slightly lower the dose. There are always options, but those options completely disappear if you choose to suffer in silence. Section 3. Lisinopril and the relentless cough. Let's look at another incredibly common medication, lisinopril. While amlodipine has that swelling effect we just talked about, lisinopril is known for something entirely different. I call it the relentless cough. To explain this one, I'd like you to meet a lovely woman named Evelyn. Evelyn was a 71-year-old avid gardener who went through months of absolutely unnecessary frustration. You see, lisinopril belongs to a family of drugs called ACE inhibitors. Again, please do not worry about the complex medical name. It's really not important. All you really need to know is that it lowers your blood pressure by blocking a specific, naturally occurring enzyme in your body that usually acts to tighten up your blood vessels. By blocking the tightener, your vessels are free to relax and your pressure drops safely. It is a brilliant, literally life-saving medication for millions of people around the world. But in the medical community, the ACE inhibitor family has a very, very notorious reputation for one specific side effect: a dry, annoying, completely relentless tickle in the very back of the throat. What makes this particular cough so incredibly tricky is that it's a master of disguise. It almost never starts the very first day you take your pill. Let's look closely at Evelyn's timeline here. In month 1, Evelyn started taking lisinopril. She felt absolutely fine, completely normal. But around month 4, just as the seasons were changing to late spring, she developed a dry, persistent cough. Because she was a gardener, she naturally assumed it was just pollen or dust from the soil, or maybe her spring allergies flaring up again. We would all think that, right? She went to the pharmacy and bought antihistamines. She bought an expensive air purifier for her bedroom. She even went to her doctor and had a chest x-ray done, which showed her lungs were perfectly healthy and completely clear. By month 11, her sleep had been terribly disrupted for over half a year. And I want to be really clear about what this feels like. It is not a chesty, sick cough that produces phlegm. It is a dry, persistent tickle right at the back of your throat that wakes you up at 2 in the morning and simply will not let you go back to sleep. She was completely exhausted and irritable. Finally, her doctor asked her to trace back exactly when the cough started. When she did the math, she realized the cough appeared a few months after starting lisinopril. She had never made the connection because so much time had passed. Her doctor simply switched her to a completely different medication, and within 2 short weeks, that terrible 11-month cough vanished completely. Now, I need to pause here for a moment and draw a very strict, very clear line in the sand for you. A dry, scratchy cough from an ACE inhibitor like Lisinopril is a nuisance. It is highly annoying, it ruins your sleep, and it absolutely should be fixed by your doctor. But there is another symptom in this category of drugs that is not a nuisance at all. It is a genuine, life-threatening medical emergency. If you are taking Lisinopril or really any ACE inhibitor and you ever develop sudden swelling of your lips, your tongue, your face, or the inside of your throat, you must not wait. If it feels difficult to swallow, or if you feel literally any resistance when you breathe, you do not wait to call your doctor's office the next morning. You do not take a benign allergy pill and lie down in bed to see if it passes. You call for emergency medical help immediately. This is a rare, severe condition called angioedema, and it can close off your airway incredibly fast. Please burn this difference into your memory right now to protect yourself and your loved ones. A dry cough is a nuisance to discuss at your next visit. Swelling of the face, lips, or throat is an absolute, non-negotiable emergency. Section 4, Losartan and the potassium trap. I find the dangers associated with Losartan particularly striking because the problems rarely happen because a patient did something careless or forgot to take their pill. In fact, it is usually the exact opposite. The danger often comes from wonderful, proactive folks trying their very best to be healthy and do the right thing for their bodies. Losartan is what we call an ARB, which stands for angiotensin receptor blocker. Again, the name doesn't matter. What matters is that it works on the exact same internal system as Lisinopril, relaxing your blood vessels to gracefully bring your pressure down. And the wonderful news is, it usually completely avoids that terrible dry cough we just finished talking about. This is exactly why Evelyn's doctor switched to it. However, because of the specific way Losartan interacts with your kidneys, it has a natural tendency to hold on to potassium. It naturally raises the potassium levels in your bloodstream as it does its daily work. Under normal circumstances, with routine blood tests ordered by your doctor, this slight natural raise in potassium is perfectly safe and incredibly easy to manage. But here is the hidden trap that catches so many well-meaning seniors. Imagine your doctor tells you that you really need to lower your blood pressure, so you should cut way back on your daily sodium intake. You want to be a good patient. You want to protect your heart. So you go to the grocery store and you buy a bottle of heart-healthy salt substitute. You see that label and think, perfect. You bring it home and sprinkle it generously on your morning eggs, your steamed vegetables, and your chicken dinner. What you might not realize is that the vast majority of those over-the-counter salt substitutes replace sodium by using incredibly heavy doses of potassium chloride. So you are unknowingly pouring extra potassium into your body with literally every meal, while simultaneously taking a medication that is already instructing your body to hold on to potassium. Suddenly, your potassium levels can quietly climb to a point where they actually begin to interfere with the delicate, highly sensitive electrical system of your heart. You can also find this hidden potassium in some over-the-counter sports recovery drinks or hydration powders that folks often use during those hot summer months. The absolute scariest part about dangerously high potassium is that it doesn't always sound a loud, obvious alarm. It often announces itself very, very quietly, whispering its presence long before it shouts. I want you to look closely at these subtle warning signs and just ask yourself these questions slowly. Are you experiencing unusual muscle weakness, where your arms or legs just feel heavy, like they suddenly have no strength to lift a simple grocery bag? Do you have a deep, persistent fatigue that resting in your favorite chair simply doesn't fix? Do you ever notice a strange, dull, cramping sensation deep inside the muscles of your legs? What about a tingling, pins and needles feeling in your hands, your fingers, or around your lips? Or, most importantly of all, do you ever feel a sudden fluttering, racing, or irregular heartbeat in your chest? If you take Losartan or Lisinopril and you use a salt substitute or experience literally any of these quiet symptoms, please pick up the phone today and have a conversation with your doctor. Checking your potassium is a simple, painless blood test, and catching it early is incredibly easy to fix before it harms your heart. Section 5, Rules for Every Blood Pressure Cull. No matter which of these powerful medications is sitting in your medicine cabinet right now, there are universal, everyday rules of the road that you absolutely need to know to protect yourself from unnecessary harm. Let's start with a highly relatable scenario that almost no one ever talks about but happens to absolutely everyone at some point. What exactly should you do with your blood pressure medication if you come down with a simple, ordinary stomach bug? Now, I am not talking about a major hospitalization here. I just mean a bad few days of vomiting, diarrhea that won't seem to quit, or even just sweating really heavily during a summer heat wave while working out in the garden. Most folks, trying to be good, compliant patients, just keep taking their pill as normal. But that can be a critical mistake. When you lose fluids from a stomach bug or from heavy sweating, your body naturally becomes mildly dehydrated. Your internal environment shifts and changes. If you take your regular full dose of medication while your body is dehydrated, the drug actually acts much, much stronger than usual. Your blood pressure can plummet dangerously low, causing severe dizziness, and it can put an immense, acute strain on your precious kidneys. You need to ask your doctor for a specific sick day plan at your very next visit so you know exactly what to do when this happens. Now, let us move to pain for a second. Say your arthritis flares up in the damp weather and your knees are aching terribly. You go to the drugstore and buy common ibuprofen, like Advil or Motrin. It's sitting right there on the shelf. Anyone can buy it, so it seems perfectly harmless, right? But taking regular daily doses of over-the-counter ibuprofen actually physically reduces the blood flow to your kidneys. When you combine that reduced blood flow with powerful medications like Lisinopril or Losartan, you dramatically raise your risk of a serious, permanent kidney injury. Your kidneys do not know that the pain medicine was bought without a prescription. They only respond to the harsh chemistry. Always ask your doctor for safer pain relief alternatives that won't fight against your blood pressure pills. And lastly, let us look at the simple, everyday act of standing up. Have you ever stood up from the couch after watching a long movie or gotten out of bed in the dark and suddenly the whole world just tilts? You feel a wave of dizziness. You quickly grab the doorframe to steady yourself, and a few seconds later, it finally passes. We've all been there. But many seniors on blood pressure pills accept this scary sensation as perfectly normal. Please listen to me closely here. In an older adult, just a few brief seconds of dizziness is more than enough to cause a devastating fall. And a fall can easily cause a hip fracture, which can permanently change the entire trajectory of your health and your treasured independence. This dizziness happens because your medication is actively doing its job. It is keeping your blood pressure beautifully low. But when you stand up fast, gravity suddenly pulls your blood down toward your feet, and your system simply hasn't had the time to pump it back up to your brain. You must consciously change how you move through the world. Rise slowly from lying down. Sit on the edge of the bed for a full, uninterrupted moment before putting weight on your legs. Hold on to a sturdy nightstand or a heavy chair. Just give your remarkable, hardworking body a few extra seconds to adjust to the sudden change in position. Preventing a fall is simply one of the absolute most important things you can do for your long-term health and mobility. Before we finish our time together today, I want to talk about taking your blood pressure at home. The number 5 is absolutely critical here. When you sit down at your kitchen table to check your numbers, you must give yourself exactly 5 minutes of total quiet rest before pushing that start button on your machine. I see this all the time. Folks checking it right after walking inside from getting the mail. Don't do that. Do not check it while watching a loud, stressful news program on television. Do not check it while chatting animatedly about your day with your spouse. Your blood pressure fluctuates constantly throughout the day, based on movement, stress, and even the simple act of talking. Give yourself 5 completely quiet minutes with your feet flat on the floor and your arm fully supported to ensure you get an accurate, reliable reading. And when you do finally take those readings, I really want you to embrace a very comforting, gentle philosophy. Let patterns, not panic, guide your medical conversations. If you have a single, surprisingly high reading on a random Tuesday morning because you slept poorly or felt anxious, it does not mean your medication has suddenly stopped working. If you have a lower reading on a hot Thursday afternoon, it doesn't mean your dose is completely wrong and needs to be thrown out. Blood pressure is incredibly dynamic. It moves, it flows. What your doctor actually cares about is the steady, reliable pattern over several weeks. Keep a consistent, honest log in a little notebook. Never take an extra pill out of sudden fear, and never skip a pill just because you feel fine that day. Consistency is the true secret to making these powerful medications work safely for you. We have covered so much vital ground today, and you have done wonderfully staying with me through all of this really important information. But if you only remember one single thing from our entire explainer today, I want it to be this. Silence is not compliance. Let me say that again. Silence is not compliance. Your voice is a critical part of your treatment plan. Side effects are not a character flaw. They do not mean you are complaining too much, and they absolutely do not mean you are just being overly sensitive to getting older. Symptoms are simply your physical body trying to communicate with you through the only language it knows. A medication that beautifully lowers your blood pressure on paper but ruins your sleep with a relentless cough, or makes your feet so swollen you literally cannot take your daily walk, or makes you so incredibly dizzy you live in constant fear of falling, that is not a successful medication for you. Do not suffer quietly assuming you just have to live with it. I will leave you with this final, important thought, and I really want you to consider it very carefully as you go about the rest of your day. Are you quietly enduring a side effect, right now, today, that your doctor could easily fix for you tomorrow? Whether it is the uncomfortable swelling of Amlodipine, the frustrating cough of Lisinopril, or a quiet worry about Losartan in your daily diet, I strongly, strongly encourage you to pick up the phone. Call your doctor's office. Ask for that sick day plan we talked about. Tell them honestly about your symptoms. There are almost always alternative medications, minor dosage adjustments, and simple, safe strategies available to you, but they can only help you if you choose to speak up. Thank you so much for taking your precious health seriously and for spending this quiet time learning with me today. If this explainer brought you some clarity and comfort, please share it with a friend or a loved one who also takes these daily medications. Take good care of yourself, remember to take your time standing up today, and I will see you on our next explainer.